can we now talk about how Tele ICU would change the global scenario and how you perceive it would be 10 years from now?
Sure. So I think, honestly, medicine's evolving rapidly, and we have these amazing treatments now. I don't know if you read, but there was this genetic treatment they came up with few weeks ago. Within 36 hours or so, they diagnosed and treated a baby with a very kind of specific treatment they evolved for that child within 36 hours. So medicine is going to go that direction, and you're going to get very specific therapies. You're going to have better technology. We talk about home monitoring of patients with all the vital signs. I'm sure your watch can measure your oxygen level, your anaerobic threshold. It can do all kinds of things. But if you look at the basics of it, ultimately we still have to consider the communication, the compassion, and the care. Because critical care is all about caring. It's critical to care. So it's important that doesn't matter what the technology is, we need to have that empathy with the patient at the remote site. That will never change. The physiology of the patient, the pathologies, they won't change. But Tele ICU has the ability now to actually deliver very advanced level management care of patients to places which don't have it right now. So you may not have the ability to get a specialist to a remote site, but you can guide them with standard scientific ways of managing the patient, especially a patient on a ventilator, for example. You can also do a lot of things in terms of education. Now, nurses are very key to critical care, and you can do nurse education on a daily basis, and of course doctor education too. You can also do things like telepharmacy, where you're actually looking for drug interactions. You're looking for appropriate dosing of antibiotics, appropriate dosing in terms of patients with kidney failure. What do you do in terms of the dose of drugs? You can do those things. There's a lot of remotely possible things that you can do with Tele ICU. And in an ideal world, you have no borders in terms of the healthcare, because ultimately human beings are the same everywhere. So you should be able to deliver critical care to anybody who needs it anywhere, anytime. And we actually I do this for the United States from India, and we do it for all over India, and there are places which are evolving trans-border critical care from wherever to wherever. And that's a direction which I think we are going. The other interesting direction we're going in is the use of technology like artificial intelligence to automatically detect changes early, like picking up sepsis early, picking up abnormal vital signs early. That's already happening. The other direction is remote surgery. There have been experimental situations where people have done operations using robotic technology way far ahead and almost 8,000, 10,000 kilometers away. Now, why is this important? We're exploring other planets. We're exploring the oceans. So you may have difficulty in actually communicating, and you may need autonomous systems and remote ways to do these things. There's also the interesting thing I was reading about called haptic technology, where surgeons, now you've heard of robotic surgery, where patients are somewhere, the surgeon is elsewhere and they're operating, but now they have these systems where you can actually get the feedback. If you're cutting through skin, you're cutting through bone, you actually know what you're cutting through, and these are coming up. So technology is evolving very rapidly, and you're getting rapid diagnostics. You can know exactly what's wrong with the patient using mini scopes, etc. So as technology evolves, the cost is unfortunately going up, but also I'm foreseeing that with the use of systems issues like Tele ICU, you can keep the costs controlled.
Okay. So let me ask a very humane question at this point. And the fact is, there's a lot of worry that Tele ICU might just make certain healthcare workers obsolete. Or reduce the number of jobs available, and it's a concern that is also seen with AI and ML. There's a concern that if AI and ML took over healthcare, and I always think that the one thing that machines or technology cannot do is the human touch, and I do believe in the human touch of healing. So, how do you think Tele ICU can incorporate this into?
Sure. See, I think it's a very good question you asked, Dr. Singh. I think, as I mentioned earlier, there's nothing more central to care than empathy and compassion, because ultimately, most of us became healthcare providers because we want to help somebody out.
Exactly.
And Tele ICU, regular ICU, surgery, medicine, whatever, it's just a vehicle to deliver the care to a patient. And the doubt that a lot of people have is, will jobs be lost because of technology? If you look at history, actually, that hasn't been true. You need somebody to build these machines. You need somebody to understand the technology of it. You need somebody to use these in an appropriate way. You need people to regulate how these things are done. So the jobs might shift and change, Roles might change, but I don't think the number of jobs will go down because you will always need someone to manage a higher level of this.
Okay.
In addition to that, it's also possible that people will have shorter work weeks.
Okay.
People will, have more time to spend and have what's called the work-life, not really the balance, but the harmony between work and life. And it may be that people may not want to work that much. So there are other factors playing in a role where things will adapt. But at the same time, AI, ML, all of these technologies, Tele ICU, all of these technologies are really just a tool to
Correct.
really deliver care.
Yeah.
So I don't think we will be faced with a situation where jobs will be lost.
So I think what you're trying to say is like, how the stethoscope is an adjunct to diagnosis. Tele ICU, AI, ML would also be adjuncts to diagnosis.
Absolutely.
The human touch would still be maintained in patient.
Absolutely. And I'm sure you've seen those movies where these android robots have the human touch, and I know it's scary to think of, but that's happening. And by the way, the stethoscope's obsolete already. People are using handheld ultrasounds to do everything,
Yeah.
especially in critical care. And that's a topic for another day.
Another day.
Yeah.
Thank you so much, Dr. Praveen Haranath, and thank you for watching.